Congratulations for reaching a milestone in corneal transplantations. How's the journey?
Thank you. It's been a glorious journey. Very gratifying that we could touch the lives of so many people in an area where in India for long was considered an impossible thing. And in fact, when we started the journey, everybody discouraged me not to pursue this path because it would invariably end in a failure. But we continued and it worked. It happened because of support and from a lot of people, a lot of organizations, and we are very grateful. And more importantly, we have to express our gratitude to the thousands of eye donors, the families of eye donors that made this possible. If they didn't do it, we couldn't have been sitting here today. And the myth that in India nobody donates eyes, we have proven to be wrong. In India, many people, once they are convinced, once somebody explains to them the benefits, many. In the hospitals in Hyderabad, our experience is 60 to 70% of the families that were approached consent to donate the eyes of their family member. It's as good or better than American hospitals.
Okay.
Yeah.
Sir, if I am not wrong, I came to know that you started this corneal transplantation during 90s. If I am right.
80s.
80s.
Yeah.
So now we may have some knowledge about transplantations and organ donations, but then there is so much myths about these transplantations or organ donation. How you manage people to donate their organs or corneas?
The knowledge was there even then, but we were not practicing in our country. And all that we did is we learned the lessons from elsewhere, borrowed them, and implemented them here. That was the first step. And for that we got a lot of support and cooperation from the US in particular. They helped us to set up our eye banks, they helped us to set up the systems, the standards. And corneal transplantation surgery, since I was trained and I practiced that in America, we came and started a training program. We trained many doctors. So once the doctors are available and the donor corneas are available, then the journey became relatively easier. And then the challenge is now, Praveen is working on it. How do we improve the success rate? Because we found out a lot of people may not come back for follow-up. If they don't come back for follow-up care, the chances of failure of a transplant are higher. So that people have to realize follow-up is very, very crucial. And they have to comply with medications, all instructions given by the doctor. Unless that's done, getting transplant done is no use.
How much the corneal transplant success rate is in India?
In general, amongst all solid organ transplants, cornea has the highest success rate, mainly because the cornea does not depend on blood supply for its survival. It gets its nutrition from the inside of the eye and from the oxygen in the atmosphere. Because of this, when we transplant a cornea from an individual to another individual, the body of the individual doesn't really recognize it as a foreign object, and so it tends to accept it much more readily than most other organs. For this reason, there are certain diseases where the success of corneal transplantation is as high as 95 to 96%. In some diseases such as infections, the success rate might be slightly lower. But even though the success rate is lower, the fact that even if the corneal transplant doesn't work the first time, it can be successfully repeated a second time, also gives us a lot of hope that there is no incurable part of the blindness that we are dealing with. We can cure corneal blindness with transplants.
So does everyone who is suffering with this vision loss problem, do they need to go to the transplant, or who are the persons need to go for the transplant?
No, I think we have a multi-pronged approach. like Dr. Rao said, the first approach is how do we reduce the need for corneal transplants? And appropriate intervention by early treatment and identification of disease can prevent a lot of patients who require corneal transplants from getting to that stage. Once they get to that stage, now we also have advances in transplants like layer by layer transplants, which have very high success rates as well. And once transplant is done, then the journey is also a lifelong commitment by both the doctor as well as the patient, because we have to continue to take care of the transplant throughout life as well. So it is a multi-pronged approach rather than just one surgery.
Prashant Gagsu, you are managing this corneal eye bank. You know? So what exactly the problems are there in managing the eye bank?
If I talk about the eye banking status in the country, there are many problems. We have close to about 200 eye banks in the country, but almost 90% of these eye banks are dysfunctional. They do some activity but do not have cornea collection. So among 60,000 corneas that are collected today in the country, 70% of the corneas are collected in 10 eye banks only. So that means the eye banking in the country has become more of a status symbol or some kind of a, but there is no true commitment for the eye banking. On the other hand, when we look into the eye banks in our organization, we have 4 eye banks in 4 tertiary care centers, and the 5th one we will soon begin, and each of them have eye donation centers linked to these. And we are able to collect 12,000 plus corneas every year, which amounts to almost 20% of all the corneas collected into the country. So one problem is the commitment that is required. The second problem is that the eye bank typically should be run by adequately trained human resource. Many people who started eye bank, they do not invest into training of the human resource. They do not get the technicians trained or grief counselors trained. Therefore, the eye banking activity goes in the hands of less trained or untrained people, which creates its own problems. Number 3 is the medical standard. You are collecting human corneas and you will be transplanting these tissues into another human being. So there is a potential risk of transmission of diseases, the quality of the cornea not being appropriate. So it is not just taking cornea from one person and transplanting into another. You need to follow certain medical standards so that the desired objective of corneal transplantation is achieved, which is restoration of sight. So many eye banks do not follow those protocols. The third problem that we have is that we do not have accreditation systems and certification system. They are put in place by Eye Bank Association of India, but they are not uniformly implemented. And I think today these are the main factors that will enhance the availability of cornea, quality of cornea in times to come.
I came to know that LV Prasad Hospital is helping other states to establish eye banks and to maintain them. So how does this collaboration is going to work?
So we started this journey long back when we partnered with Orbis International. They started a program where they identified 10 eye banks across the country and gave us a responsibility. Can we upscale their performance and improve the quality of eye banking? So that was our first initiative as far as our objective of capacity building is concerned. I think in 2017, Hans Foundation, this is a not-for-profit organization, came forward and said that while you have eye banks wherever you are present, but there are states in the country where the corneal tissue need is there, but there are no functioning eye banks. Can you help set up those eye banks. So in collaboration with the Hans Foundation, we took the responsibility of creating eye banks in other parts of the country, and first such eye bank we inaugurated in the All India Institute of Medical Science, Rishikesh. We started another eye bank in Regional Eye Institute, Guwahati, and then immediately after COVID we helped Banaras Hindu University Institute of Medical Sciences start their eye bank. Today we have signed an MOU to work on 2 more eye banks. One will be in Patna, another will be in Ranchi. So like that, we are working on creating similar models of eye bank in other parts of the country. We train their human resource. We also help set up the infrastructure. We train them into protocols, and we handhold those eye banks for 2 to 3 years till their performance is an optimal level, and then they become self-sufficient.
Nageswara sir, you started grief counselor system. So how does it works? And I think it is the major reason behind increasing this corneal transplantation. Can you please share something about that?
It's the training of people to be able to talk to the families at the most difficult time for those families. When you realize that a particular person is unlikely to survive during hospitalization, that's the time when you begin the conversation with the family. And then gently begin to tell them of the benefits of organ transplantation, in this case corneal transplantation. And by their donation or their gesture, 2 people who cannot see today will be able to see. Those kinds of counseling has to be done, and that is the training that is given to the grief counselors. And then they are full-time placed in these general hospitals where usually the deaths happen, and that's how the program. I saw the benefits of that when I was living in the US. I lived there for 12 years. The first 6-7 years, it was terrible because like here, the corneas weren't available, and we had to operate whenever there was a cornea available. So quite often we were doing corneal transplants in the middle of the night and all that, and patients waiting for months together on the waiting list. And then this came, the hospital cornea retrieval program, the idea, and grief counselors. Literally overnight the whole thing changed. I was able to schedule the patients for transplant surgery the way I scheduled for cataract surgery. Planned, scheduled surgery for them, not in the middle of the night. So that was a great lesson, and I very much wanted that to be brought to India and implement in our hospitals. Thankfully, there was cooperation from initially Nizams and then other hospitals, and now many hospitals in the country are supporting that.
Even though we have advanced technologies, even till today, so many people are ignoring eye problems when compared to other health issues.
Right.
What may be the reason behind that?
For a long time, it was a lack of awareness. Now it is not so much lack of awareness. People kind of much better the awareness thing. But I think it's the access to care more than anything else. Availability facilities are available all across the country. And then in terms of affordability, many institutions and government sector is available where you don't have to spend any money. So it's a question of the people who had the problem accessing those facilities and getting their care. That's where the challenge still is.
So, but do we have that many skilled doctors or skilled persons in eye care?
I think we don't do too poorly, because in India we probably have one ophthalmologist for every 80 to 100,000 people. So that's good compared to, that's better than UK, for example. and many other developing countries. Among all the developing countries are low, so-called mid and low resource countries, we are ahead in eye care. Today we do the highest number of cataract surgeries in the world, about 8 million procedures a year. So like that, it used to be 1 million in the early 90s. It has multiplied 8 times in the last 30, 40 years. So same thing can happen in every area. It's a question of focus, investment, creating the system and replicating it and scaling it.
So in India, myopathy cases are increasing day by day. So what is the reason, and do we really have a good treatment for that?
I think the factors that are identified are too much near work all the time. It's not just the screen. Even if you read a book all the time, that also leads to myopia. Too much near work. The second is not spending enough time outdoors looking at the distance. So if you go to East Asian countries like Singapore, Hong Kong, China, it's mandated that all school children in the middle of the day have to get out for an hour minimum and play. They can't be inside. The second factor that they identified is the light. So in some places in those countries, they have schools where the walls are made of a glass. So there's more light coming inside. So there are lots of theories, and now there's a lot of work going on, including in our institute, where we are trying to identify the factors. And we also have a good system of advising the families of these children how to prevent progression or arresting the progression of myopia.
So finally, what the message you want to give for the people to take care of their eye health, and as a society, what can we do to increase this corneal donations?
Whenever there is a death, think of the idea that you can help 2 people with corneas, you can help people with your kidneys, you can help people with your heart, you can help with your liver. There's so much that our bodies can do instead of getting it burnt. So that's an opportunity. You can give life to 5 to 10 other people. So I think everybody, we don't even have to go into rural areas. We first should start in urban areas, that awareness among the urban population should increase, that they have an opportunity to do this donation better than any other donation that we can think of. And as somebody told me at one time, the investment on return for that is the blessings of those people. Blessings are the best form of wealth that you can accumulate.
Thank you, sir. Thank you so much.